All right, so let's start with that positive top story on the COVID-19 front. Cases have dropped by 27% in the past week. Gauteng is also finally coming out of the fourth wave. Health Minister Dr. Joe Phaahla held a media briefing this morning, and our reporter Heidi Giokos was listening in. She joins us now. Hello, Heidi. So, the health briefing, the first one for 2022, and it seems like it's starting on a positive note.
Yes, certainly, Sally. I think we were all very worried about this new variant, Omicron, and how highly transmissible we were told it is. But it seems as though things are moving the way government wants it to move, in terms of very low hospitalization, very low death rates. And it seems as though even though Omicron is highly transmissible and you could possibly be reinfected if you've been infected with other variants from other waves, it seems as though it's a lot milder this time around. So there's been a massive reduction in new infections over the last 7 days, 27%. Of course, government is still very worried about the positivity rate because it needs to be under 10% for us to be in a good space. But the positivity rate has also definitely decreased. Many were also concerned that after the festive season, after people return back home and to work, there would be a spike in infection. But it doesn't seem to be the case. I mean, the positivity rate is just under 15% at the moment, and it seems to be decreasing almost every day. And it's also relative to how many tests we are conducting, and with the results, the positive infection results that we are getting. So hospitalizations very low, and death rates also very low, especially because you're finding that those that are being hospitalized are the unvaccinated, and this is the concern from government, of course. But it does seem as though it's a lot milder, but there is concern that we must still take Omicron very seriously, because in the unvaccinated, you're most likely to get very sick, and also those that have comorbidities. But let's listen into what Health Minister Dr. Joe Phaahla had to say about this.
In South Africa, in the first week of 2022, we have seen a 13.9, almost 14% reduction in the number of new cases. In this first week of January, there were 46,680 cases compared to the last week of 2021, where we had 54,191 new cases. In the past week, the Western Cape had the highest number of new cases, followed by KwaZulu-Natal and then Gauteng. All other provinces accounted for only 11% of new cases. There has been a 4.8, almost a 5% reduction in reported deaths over the last 7 days. As of yesterday, the 13th of January, there has been a 27% reduction in new cases compared to 7 days before on a national scale, and the reduction was in all provinces in terms of new cases.
Yeah, and Heidi, as you were saying just a little earlier, vaccination remains important, because the people that end up in hospital with Omicron, the people that are dying from Omicron, and people are still dying, but not at the levels that we saw with Delta, those are largely unvaccinated people. I want us to quickly take a listen to what the Minister had to say about vaccination.
The lowest coverage is our biggest cohort, which is the 18 to 34 years of age, which is still at 31.6%. As you know, we have also opened up for boosters for the general population, following the Sisonke 2 boosters for health workers. And these boosters have now been opened for the general adult population, with Pfizer third dose being available after 6 months of your second dose, and the J&J second dose being available after 2 months of your one dose of a J&J vaccine. So this is now available. People just have to check their last dates of the second dose of Pfizer and the one dose of J&J. 6 months for the one, that is the Pfizer, and 2 months for the J&J. Then you can present yourself, even if you have not received a message, to your nearest vaccination point. You'll get your booster. Our main priority then, nevertheless, remained the full vaccination of all adults, at least up to 70% coverage.
Yeah, and the minister also made the point that vaccination coverage is higher in those older, more risky groups. But as he was saying, they really do need to boost vaccinations. What did he say, bearing in mind that this was largely really positive news, the fact that Gauteng is out of the fourth wave and the rest of the country seems to be following suit? What did he have to say about the news that came later in the morning, that the disaster management state of disaster is going to continue? Did he share his views to perhaps precede that announcement that came from the Gauteng minister? And was he questioned about this issue of the ongoing rotation of schools?
Yes, certainly, Sally. I do think that it was important for the Department of Health and for the Health Minister to speak on this matter, because questions have been raised as to why the country is remaining in a national state of disaster, given that restrictions have been lifted, we no longer have a curfew, infection rates remain very low, deaths, hospitalization low, and they are trying to consider moving from a pandemic to endemic because we just need to learn to live with this virus. So the minister is saying, of course, the decision does not lie with the Department of Health. The decision is a decision that's made with various stakeholders, various departments, and of course at a cabinet level, and the eNCC is discussing this further. But the minister made an important point to say that it's not as though government wants to be in a national state of disaster. I think he even went as far as to say it's not something we wish to do or want to do, but it's just a measure for government to have in place should there suddenly be a dramatic increase in infections, or there's a new variant that's causing a huge concern or pressure on the healthcare systems. And then they just need to make sure that they have this National Disaster Management Act in place to make sure that they can implement further restrictions. And it's just a way for government to further put these restrictions in place should they need to. In terms of schooling, Sally, we do know that discussions are ongoing. The Minister of Basic Education, Angie Motshekga, has indicated the need for the easing of these restrictions and protocols to ease schooling, because obviously it's causing a bit of difficulties in terms of how the academic year moves forward for 2022. But he has said that it's an ongoing discussion, and they are still discussing it, and a decision will be made in the next couple of weeks, I think.
All right. Well, certainly that's a big story to watch. Thank you so much for that update. Our reporter Heidi Giokos there.